Deviant School!
Hi, and welcome to Standard Deviant School Nutrition. I'm Andy Campbell. Our program today is on nutrition and disease prevention. Okay, pop quiz. If I told you that eating the right foods could keep you clear of 4 of the top 10 causes of death, would you believe me? Well, the answer is true. There are a lot of simple things that you can do to nip those bad guys right in the bud before they ever become a problem. And we'll find out about them today.
It breaks down like this. We'll start by briefly explaining the relationship between nutrition and the immune system. Then we'll cover some of life's major worries: diabetes, atherosclerosis, hypertension, and cancer. For each disease, we'll tell you how it develops, how nutrition affects it, and what you can do to help prevent it.
Diet is one of the many lifestyle factors that may influence the risk of developing a chronic disease such as cancer, diabetes, or heart disease. Unfortunately, the relationship between chronic diseases and diet are not a simple cause and effect parallel. It's not that easy. Although some diseases are caused by poor diets and can be corrected with adjustments, many are not and require other methods of cure and prevention.
I'm sure we all know people who defy good eating habits and yet live long lives. And there are others who lead healthy lives but fall victim to chronic diseases anyway. Diet, however, can influence the time of onset and ultimate course of certain diseases. The relationship of diet and disease is also influenced by other factors, such as genetics, age, gender, lifestyle, and environment.
Okay, now that we understand nutrition's role in disease prevention, let's look at how it actually works in our immune system.
The immune system depends on the interactions and secretions of various organs and white blood cells. The immune system responds when a foreign substance penetrates the skin, the gastrointestinal tract, and/or the mucous membranes, which are the first line of defense against infection. In order to function well, the immune system must have nutrients available. Individuals who do not have sufficient nutrients in their systems develop more infections than well-nourished people do. It's as simple as that.
There are other diseases, though, that start inside the body and aren't caused by germs. They're often caused by our lifestyle, so our immune system can't do anything about them. But fortunately, you can. 2 very important factors are obesity or eating a very high-fat diet. They're factors in cancer, diabetes, strokes, and heart disease. All in all, that's 4 of the top 10 causes of death. Now, that may sound a little scary, but really it's not, because your eating habits can prevent diseases just as easily as they can cause them. With that in mind, let's take a look at diabetes.
People with diabetes either don't have insulin or don't have enough effective insulin. What's insulin? Insulin is a hormone that lets cells take glucose, the sugar molecules that power your cells, from the blood. If the glucose stays in the blood, 2 very bad things happen.
Too much glucose in the blood can lead to blood infections, kidney infections, and poor blood circulation. And 2, if the glucose is in the blood, it's not in the cells. If the cells can't get enough energy, eventually the person falls into a coma.
There are 2 types of diabetes. You may have heard them called juvenile diabetes and adult diabetes. Scientists, though, use different names that are a bit harder to roll off the tongue. So just keep them in your head as type 1 and type 2. Let's go over type 1 first. It's called insulin-dependent diabetes mellitus, IDDM. Those wacky, crazy scientists.
Someone with type 1 diabetes produces no insulin at all. The pancreas loses its ability to synthesize insulin. Without insulin, blood sugar levels get dangerously high. In order for the cells to take up the glucose from the blood, the diabetic must take insulin injections.
Type 2 diabetes is a lot more common than type 1. It tends to affect older people, but recently people as young as 30 have gotten the disease. A person's diet is a much more important factor in type 2 diabetes than in type 1. What's type 2's scientific name? Non-insulin dependent diabetes mellitus.
Someone with type 2 diabetes produces a small amount of insulin, but not enough. Type 2 diabetes is much more common. Insulin is still produced, but the body's cells resist it. This type can sometimes be controlled by diet alone. If that does not control blood glucose levels, the person may take insulin or insulin-inducing agents to increase the body's supply. These agents are known as oral hypoglycemic agents.
So, some people with non-insulin dependent diabetes mellitus do take insulin, although from the name you would think that they didn't. That's why it may be easier to remember it as type 2 diabetes.
A common myth associated with diabetes is that dietary sugar is its cause. That's baloney. Fact. Controlling sugar intake is a part of the treatment of diabetes, but sugar does not cause the development of diabetes. The major health problem associated with eating too much sugar is tooth decay, not diabetes.
Sugar can contribute to the onset of diabetes only in the sense that it may also contribute to obesity. Scientists aren't completely certain what causes diabetes in all cases, but obesity may increase the chances of activating a pre-existing gene for diabetes. For the most part, a diet rich in complex carbohydrates and fibers and low in concentrated sugars does help regulate blood glucose. Even a diet low in sugar won't prevent diabetes if the gene runs in the family.
We mentioned before that obesity is linked to diabetes. In fact, obesity triples the chances of developing type 2 diabetes. A diabetic also has increased chances of developing atherosclerosis and hypertension. Diabetics can get trapped in a vicious cycle if they're not careful. Obesity leads to enlarged fat cells, which leads to insulin resistance. Insulin resistance leads to type 2 diabetes. Diabetes leads to increased appetite and overeating, which leads back to obesity.
So what can you do to prevent type 2 diabetes? Remember, many factors aren't under your control, but your diet is. You've heard it before, you know the drill. Eat a low-fat diet and make sure you exercise.
Now let's talk about one of the scariest diseases connected to poor nutrition that can be avoided with a healthy diet: atherosclerosis.
Everyone has some degree of atherosclerosis. It usually begins with the accumulation of fat along the inner walls of the arteries. When this happens, the buildup is called plaque. Over time, this plaque hardens, which stiffens and narrows the arteries. This causes a rise in blood pressure, which further damages the artery walls. The heart has to work harder to pump the blood through the narrowed and hardened arteries.
The body responds to the damaged artery walls the way it would with any injury. It forms blood clots. When there's a lot of plaque, then the blood clots form faster than they are dissolved. This isn't a big problem in large arteries, but if the clot breaks off, it will travel through the body until it gets stuck in an artery that's too small for it. The nearby tissue can't get any nutrients. That can spell big trouble. A large clot stuck in the heart causes a heart attack. A large clot stuck in the brain causes a stroke.
It's possible to fight atherosclerosis by reducing the amount of fat in your diet, especially saturated fat. A healthy diet has a total fat intake that is less than 30% of total kilocalories consumed. Saturated fatty acids should only comprise 1/3 of that total, with dietary cholesterol less than 300 milligrams per day. This type of diet may help lower blood cholesterol levels by 5 to 10%.
Cholesterol is carried in the body by several lipoproteins. The two referred to most frequently are high-density lipoproteins, HDLs, and low-density lipoproteins, LDLs.
LDL cholesterol is strongly associated with atherosclerosis. Thus, it is known as bad cholesterol. HDL is good cholesterol. HDL reduces the risk of atherosclerosis. In other words, you want low LDL and high HDL. Vigorous exercise may increase your HDL. Another way to remember this is HDL is healthy and LDL is less healthy. Increasing consumption of complex carbohydrates and fiber may also assist in lowering LDL cholesterol.
Be aware that for most people, consumption of cholesterol in their diets does not increase their blood cholesterol level, even though you have probably heard that repeatedly. It is actually the saturated fat that seems to increase the LDL. So, dietary cholesterol has a worse reputation than it actually deserves.
Hypertension affects 60 million people in America. Hypertension is a nasty problem to have. Not only does atherosclerosis help cause hypertension, but hypertension helps cause atherosclerosis. Diabetes also helps cause hypertension. Can you guess what else helps cause hypertension? Not a difficult question, is it? Obesity. Obesity makes hypertension even worse.
Weight loss is an effective method of treatment for hypertension. Regular, moderate aerobic activity, such as brisk walking, helps reduce hypertension both directly and indirectly. It strengthens the heart and blood vessels, increases lean muscle mass, reduces the workload of the heart, changes hormone levels, and improves the movement of blood through peripheral arteries.
Salt, sodium chloride, contributes to hypertension in some individuals who are considered to be salt sensitive. Avoiding salt prevents hypertension in salt-sensitive individuals, but may not help others with hypertension. We used to believe it was the sodium that increased blood pressure, but recent research indicates it may actually be the chloride, as in sodium chloride, that causes the problem.
However, most people will not develop hypertension from excess salt consumption. Salt, like dietary cholesterol, is not as great a health risk for most people as is commonly believed.
Some research indicates potassium may help prevent and correct hypertension. Thus, increasing potassium intake may be helpful. Calcium is another mineral that seems to prevent and treat hypertension. This is another reason to at least meet the dietary recommendations for calcium. Consumption of low-fat or non-fat milk products is recommended because they provide calcium, potassium, and magnesium without all the saturated fat that comes with regular milk.
Nutrition and cancer are related in more than one way. Food may contain carcinogens, substances that initiate cancer, but food may also contain substances that protect against cancer. For folks with cancer, proper nutrition may facilitate recovery and improve quality of life. Food additives have a bad reputation for causing cancer, like dietary cholesterol and salt. However, food additives are probably blamed for problems they did not cause.
Cancer occurs when a cancer-causing agent, a carcinogen, enters into a cell and changes the cell's DNA, causing it to multiply out of control. The cancerous cells form a tumor. If it's a benign tumor, it doesn't invade nearby tissue or spread through the body. If it's a malignant tumor, then it spreads through the body, often resulting in death.
Dietary fiber may reduce the risk of certain cancers, particularly colon cancer. This may be because fiber decreases the length of time the colon is exposed to carcinogens, or it may be because it speeds the excretion of foodstuff from the body. In general, a diet that is low in meat products and high in vegetable and grain products is associated with lower rates of cancer. Yellow and green vegetables and fruits seem particularly effective in protecting against cancer. The American Cancer Society recommends 5 fruits and vegetables a day.
Smoking, alcohol, pollution, and genetics may all contribute to the risk of cancer. You may also want to avoid potential carcinogens by reducing your consumption of foods preserved by salt, smoke, or nitrates.
Okay, let's go over what we learned. Diet and lifestyle are major factors in preventing and even causing certain diseases. The best thing to do is eat a healthy, well-balanced diet that's low in fat and get plenty of exercise. There are 2 types of diabetes. Type 1 diabetics don't produce any insulin. They have to take insulin. Type 2 diabetics produce some insulin, but their cells don't absorb it easily. They can control their diabetes through diet and, if necessary, insulin supplements. Diabetes is also linked to obesity, hypertension, and atherosclerosis. Atherosclerosis occurs when plaque builds up in the artery walls, causing damage to your circulatory system. Atherosclerosis has an effect on diabetes and hypertension, and is a contributor to heart attacks and strokes. Atherosclerosis can be controlled by a diet that's low in saturated fat and cholesterol. Hypertension is high blood pressure. It has an effect on diabetes and atherosclerosis and can lead to heart attacks and strokes. Exercise, a low-fat diet, and a low-salt diet can help reduce hypertension. And finally, cancer. Cancer occurs when a carcinogen enters a cell and changes the cell's DNA so that it multiplies out of control and forms a tumor. Your risk of developing some types of cancer are increased by eating a high-fat diet. Your risk of developing cancer can be decreased by eating high-fiber foods and those wonderful green and yellow vegetables that provide you with vitamins A, C, and E.
And that about wraps it up for nutrition and disease prevention. We hope you learned a few things about how to stay healthy and how to keep diseases far, far away. Thanks for watching Standard Deviant School Nutrition. I'm Andy Campbell. Take care of yourself.